Your eyes are red, they've been this way for over a week. What could be causing this and how can we fix it? Let's talk. All right, let me tell you a story. This is one that I've seen 1,000 times in clinic. A patient comes in and they have red eyes. It's not a beet dark red, but it's a mild redness. Their eyes are watering. They've flushed their eyes. They've tried artificial tears. They want to know what's going on. When I ask them what other symptoms they have, they usually say they have some form of sneezing, coughing. They've been working outside in the yard quite a bit. It's spring, it's fall, and now their eyes are red and irritated. Well, guess what? If nothing's in their eyes, this usually means they have seasonal allergies. Now, seasonal allergies can happen year-round. I know they're called seasonal, but you look for triggers. Triggers usually come from the outdoors. Pollen, leaves, flowers, all these things can get in your eyes and cause irritation. However, your home can be a breeding ground for allergens. Talking about pet dander, dust, debris, all these things can also cause an allergic reaction to your eyes. When's the last time you cleaned out the furnace filter or the air conditioning filter? Yeah, disgusting, right? In addition, depending on where you work, there's chemical irritants. Gasoline, chemicals in the air such as perfumes, fragrances. These things can affect your eyes. So if you had a new infuser that you brought into the house, think twice if now all of a sudden you have red, irritated eyes. You might be allergic to whatever you're putting into the air. Now, invariably, when I'm talking to these patients, they say, yes, I have one of these things, or this is happening. Sometimes they get new makeup and that's causing their allergy. So if you have anything new that you've started doing, that's culprit number one. Let's examine that and see if you remove that from your life, if things get better. All right, so we've talked about the triggers. What do you do next? Well, the obvious thing is avoid the triggers. When I talk to my patients, I tell them, keep your windows closed so that pollen and debris doesn't get into your house. I love a nice warm breeze. However, if your eyes are affected, you can suck it up, turn on the air conditioning. Make sure you clean out the filters of your furnace or your air conditioner. These things go a long way. Believe it or not, things as simple as wearing glasses or sunglasses when you're outside can help protect your eyes from getting the debris, the allergens in there causing the irritation. I always tell my patients at the end of the day, wash your face, your pillowcase, and your hair. All of these things can get the allergens, and as you go to sleep at night, you're constantly exposing your eyes to them. So try to keep those things clean. In the short term, the things that I like to do for my patients, I like to prescribe them an artificial tear. Okay, artificial tears help lubricate the eyes. They help flush out any of the irritant that you have in there. The allergens are not your friend. So try to use preservative-free artificial tears. Systane Complete preservative-free is one of my favorite ones because it has a multi-dose dispenser. That means you can use it multiple times without opening an individual vial every single time. It's more portable, and by not having the preservatives in there, you have one less thing that can irritate your eyes. In addition, we like to prescribe drops that are mast cell stabilizers and antihistamines. Okay, what does that mean? Well, mast cells release all the histamine that cause your eyes to itch. We got to get rid of those bad guys. The antihistamine binds with the histamine so it doesn't cause your eyes the irritation. If you just get an antihistamine eye drop, you're not going to get to the root cause of the problem. So I like combination drops. Pataday is my favorite one. It used to be my most prescribed, but now it's available over the counter. The last thing you can do that's simple and quick is a cold compress. When your eyes are irritated, when they itch, you want to constrict blood flow. A lot of different things will benefit from heat. Allergies are not one of them. Use cold to calm that inflammation, get your eyes feeling better. Now, if this is a chronic problem that you just can't kick with the over-the-counter methods, we can prescribe steroids. We just don't like to use those long-term. And get in, see an allergist. They can do allergy shots that can help suppress these symptoms in your whole body. Remember, sneezing, coughing, stuffy nose is often associated with allergies. So I care about your eyes, but an allergist will help you treat the whole body. If you learned something new, like, subscribe, and we'll see you in the next video.